Good morning to all and welcome to the True Hunt. We have got Dr. Anshuman Manaswi with us from Mumbai, and he's a plastic surgeon, and he's connecting with us to discuss that recently the central government has introduced that now every practicing doctors all across India have to register on the website of National Medical Commission. And apart from that, from now on, every practicing doctor across India have to register after 5 years for renewing their license. So he has joined with us to put more light on this. Sir, welcome to the True Hunt. Of course, my question is, as your doctor yourself, sir, what is the thing? Please elaborate on this.
Thank you, Gaurav, for having invited me. I have some things good to say about it and some things really which are not very clear and must be addressed before we actually embark on this journey. Now, central registration for all the doctors is a good thing. Okay, that will prevent unqualified doctors to come into picture. Second thing is about renewal of the license. That is also good because some people stop practicing after some time and they should have the option of not renewing. But here is a bigger question, that what are the criteria for renewing it? If we have to renew it, a lot of times we are subjected to having multiple conferences, lectures and trainings, and we have to shell it from our own pocket. Now, these programs which are designed for which we have to submit the CME accreditation points have to be funded by us. That is putting additional burden on our pocket. That is something if the government wants us to attend a certain number of conferences and all that, and so that we are abreast with the latest knowledge, it is fair, but the government should be providing it free of cost to the doctors, because it is something which we have to take out time from our daily schedule and we have to go to other places, attend the conferences. So this should be a normal part of the 365 days curriculum that we should get a choice of attending, and that should be free of cost, and that should also be webinar linked. The second point is well taken, that if there is a state medical registry which rejects any registration, one can appeal. That is a good point which is there. But the larger point is that why it is there only for modern medicine or so-called allopathy medicine. The other stream of medicine like Ayurveda, like homeopath, like Unani, they are not well regulated. And all these restrictions are coming only on allopathy doctors. So we are competing with regulation versus unregulated or minimally regulated bodies. That is really unfair. And we see that, at least in my practice, I can tell you there are hundreds of cosmetology clinics which have cropped up. So yes, this is a good thing, but this is only just a part of the thing. A lot of work needs to be done.
Of course, we have talked about the licensing part, which the government says after every 5 years it has to be renewed. But with the new thing, I will again speak on website, the registration, in which, as I have got some stats with me, in which it says that a doctor across anywhere in India have to register with some sort of information in which his qualification, the university or the institution names, the specialty which he holds, and apart from that, the name of the hospital or the clinic or the institution where he's working, he has to fill those details on that particular website from now on. Sir, what is that and how it will benefit the system?
This is very fair in the digital area. We should opt for a transparent practice. And if I am practicing somewhere, people should all have all my details, that who am I, where have I qualified from, what is my standing, where do I work. So this is absolutely fair and government is right on that. But the question again is that what are you doing with that? Now, I am a plastic surgeon. Somebody is, I have studied for after MBBS for 6 more years. There's somebody who's earned a MS degree who has worked for 3 years. There's somebody who is MBBS who has not any further degree. So there should be guideline as to who can do what. I think this need to have a much bigger discussion with a lot of stakeholders who are there, and then only things can be sorted out.
Sir, my last question to you, it's for the understanding. For example, we have got one doctor who has practiced for like 3 years, and after that he changes his profession, like enters into some government job by giving some examination or something with altogether a different field. So in that case, of course, he has practiced for 3 years and he has got that license, because earlier license was given in one go. Just for a single time, the license was issued and which was retained till the lifetime. And now the new guidelines says that a license has to be renewed after every 5 years. So, sir, in this cases also, that would be a weed out for the people who have left their profession completely and not practicing.
This is a very, very complex question, but yes, straightforward answer should be that if they have changed their stream, they should not be allowed to practice because they are not abreast with the latest what is happening in medical advances and what is happening in the medical field. But the problem happens if you take away their licenses, they still do have a decent knowledge about what to do in an emergency. And if you take away their license, even if it is possible for them to help in an emergency, medical emergency, which can come up anytime, they would wash their hands off. So who takes the responsibility of a trained resource not being able to come to a rescue or in the villages? So maybe with limited allowance of certain things, they should be allowed to practice.
And they should be given at least some updation of training from time to time from
Yes,
their working
yes,
schedule as well,
yes.
so that at least the doctors can be used in the time of emergency, as we have seen in the past as well.
Absolutely, because doctor, I mean, training a doctor for 5.5 years, a lot of resources are spent on that training, even from the doctor's side, from the person's side, and from the government side.
Thank you so much. This was Dr. Anshuman Manaswi from Mumbai, who has highlighted on recent notification of the central government for a registration process on the NMC website, and of course the renewing of licenses of the doctors every 5 years. Thank you so much, and Jai Hind, sir.